Chairman Cummings, you spoke of crying when the ACA was passed, and were moved that you feel so strongly about healthcare as a human right. Unfortunately for nurses, the tears continue to flow daily. Nurses cry daily because they go home after seeing patients who cannot afford their care. They can't afford their medication. They can't afford the high copays. They can't afford treatment for their children to keep them alive. That means that they're not going to the doctor when they need to. They're delaying care so they come in sicker. Nurses are seeing people who have insurance and preventable issues, but they come in sicker and harder to heal because they're afraid to go to the doctor because they can't afford it. It's no wonder that the majority of U.S. bankruptcies are from medical expenses. The majority of those were actually people who have insurance. People are going bankrupt who have insurance. It's such a cruel system. It's a cruel system. Luckily, nurses have the cure: improved Medicare for all. It provides a single standard of care, freedom to choose a doctor, while saving over $1 trillion over the next 10 years. Plus, it isn't based on the size of your wallet. You wouldn't go bankrupt because of a diagnosis like cancer. Nothing can refute that Medicare for all would save lives, save money, and cover everyone with a single standard of care. Every study shows that. Every study shows that. Nurses are not alone. 56% of all Americans support Medicare for all, as you've heard today. 81% of Democrats support a Medicare for all system. How can this not be in the Democratic platform? How can it not? Your base is with you. As your mother said, Chairman Cummings, and you have all the good quotes, sorry, sometimes you have to wait for people to catch up when you do the right thing. This is certainly the right thing. The party needs to seize this as an opportunity to make bold change. Otherwise, people are dying and going bankrupt while they wait for the Democratic Party leadership to catch up.